Climate change is more than just rising temperatures and extreme weather events. It's a force that's reshaping our world in ways that aren't always visible. One of the most pressing challenges is how climate change deepens existing health disparities. In this video, we'll explore how climate-induced factors impact health outcomes, especially for vulnerable communities. We'll look at what these disparities mean, who's most affected, and why addressing them is crucial for a healthier, more equitable future. Let's start by understanding the basics of climate-induced health disparities. Health disparities refer to differences in health outcomes among different groups of people. These differences are often linked to social, economic, and environmental disadvantages. When climate change enters the equation, it can make these gaps even wider. For example, low-income communities may have less access to healthcare or safe housing, making them more vulnerable to climate-related health risks. Understanding these disparities is the first step toward finding a solution. Not everyone experiences climate change the same way. Some groups are more vulnerable due to where they live, their age, income, or existing health conditions. For instance, elderly people, children, and those with chronic illnesses are at higher risk during heat waves or air pollution events. Communities living in flood-prone or drought-affected areas also face greater health threats. Recognizing these vulnerabilities helps us understand why targeted action is necessary. Extreme heat events are becoming more common due to climate change. These heat waves can lead to heat exhaustion, dehydration, and even death, especially among the elderly and those without access to air conditioning. Urban areas with their concrete and limited green space often experience higher temperatures, a phenomenon known as the urban heat island effect. Low-income neighborhoods are less likely to have cooling centers or tree cover, increasing health risks. As temperatures rise, air quality often worsens. Higher heat can increase ground-level ozone and worsen air pollution, leading to more cases of asthma and other respiratory problems. Children and people living in industrial or densely populated areas are especially at risk. Poor air quality doesn't affect everyone equally. Those with limited healthcare access or pre-existing conditions suffer the most. Climate change is expanding the range of disease-carrying insects like mosquitoes and ticks. Warmer temperatures and changing rainfall patterns allow these vectors to thrive in new regions, bringing diseases such as malaria, dengue, and Lyme disease to areas previously unaffected. Communities with limited public health infrastructure are less able to respond, increasing health disparities. Climate change disrupts food production through droughts, floods, and unpredictable weather. This can lead to food shortages, higher prices, and malnutrition, especially in communities already struggling with poverty. Children and pregnant women are particularly vulnerable to the health impacts of poor nutrition. Ensuring food security is a key part of addressing climate-induced health disparities. Floods and droughts caused by climate change can contaminate water supplies or reduce access to clean water. This increases the risk of waterborne diseases like cholera and diarrhea, which can be deadly, especially for young children. Rural and marginalized communities often lack the resources to ensure safe water, deepening health disparities. Stress and trauma caused by climate-related disasters, like hurricanes, wildfires, and floods, can take a toll on mental health. Displacement, loss of homes, and uncertainty about the future can lead to anxiety, depression, and post-traumatic stress. Access to mental health services is often limited in affected communities, making recovery even harder. Climate change is forcing people to leave their homes due to rising sea levels, drought, or extreme weather. Displacement disrupts access to healthcare, education, and stable living conditions. Migrant and refugee populations often face barriers to receiving adequate health services, increasing their vulnerability to illness and injury. Economic status plays a major role in how people experience climate-induced health risks. Wealthier individuals and communities can often afford to adapt by moving, installing air conditioning, or accessing better healthcare. In contrast, low-income groups may lack these options, making them more susceptible to the negative health impacts of climate change. Indigenous and rural communities often have a close relationship with the land and depend on natural resources for their livelihoods. Climate change threatens traditional ways of life, food sources, and health. These communities may also face systemic barriers to healthcare and support, making them particularly vulnerable to climate-induced health disparities. Urban and rural areas experience climate impacts differently. Urban residents may face more intense heat and air pollution, while rural communities might struggle with water scarcity or agricultural losses. Both settings present unique health challenges, and solutions must be tailored to address these specific needs. Addressing climate-induced health disparities requires coordinated action from governments, communities, and individuals. Policies that improve access to healthcare, invest in resilient infrastructure, and support vulnerable populations are essential. Community-led initiatives can also make a big difference, empowering those most affected to shape solutions. Solving climate-induced health disparities isn't just about addressing the symptoms, it's about tackling the root causes of inequality. By prioritizing equity in climate and health policies, we can build a future where everyone has the opportunity to live a healthy life, no matter where they live or what resources they have. Together, we can create lasting change for generations to come.